Ageism hurts old people and young people. Let's talk about it today on The Wrinkle. If you haven't watched before, my name is Dr. Nicole Didyk. I'm a medical doctor. I'm board certified in internal medicine and geriatrics, so I specialize in the care of older adults. A big part of my job here on The Wrinkle and in my medical practice is fighting ageism. Ageist attitudes can be harmful, but not just to old people. Ageism is defined as a prejudice or discrimination against a person because of their age. This can happen in a personal situation, or it can also be institutional. Ageism we usually think about in the context of an older person, and that's often how I think about it because of my professional focus. But ageism can affect the young as well. So it could happen in the workplace and often does. For example, if you think someone's too old to hire or somebody's too young to be a manager. That's discrimination based on age, and it's wrong. Ageism can really get in the way of my job when it comes to cognitive impairment as well. Have you heard of the term senility? A lot of people think that getting senile is a normal part of aging. But I don't even know what senility is. I mean, from a medical standpoint, it really just means something that's associated with senescence or aging. But the term senility, I think, popularly is used to mean age-related cognitive impairment. And that's not universal. There are some cognitive changes that happen to almost everybody as they get older, but it shouldn't be to the extent where the person has trouble with their day-to-day life, or even that other people would notice. Only 11% of people 75 to 84 are living with dementia in Canada. That number does go up to 35% in those over 85, but that's still the minority of people. So having dementia isn't a normal part of aging, and it isn't something that happens to everyone or even to most people. Only 5% of people over the age of 65 are living in what we would consider a specialized home or an institution. So most older adults are out there free ranging around, just like people in their 30s and 40s. Not everybody who is an older adult has dementia and is living in a senior's home. That's a stereotype. Just think about the Golden Girls. They weren't living in a home. They weren't using a cane or a walker, I don't think. Maybe Sophia did a few times. But, 20 years after that show has gone off the air, Betty White is in her 90s and she's a working actress. So that kind of turns ageism on its head. Ageism doesn't just hurt older adults. Ageist stereotypes prevent us from really relating to each other and talking about what's important as people get older. It's true. I mean, someone who is 80 is likely to be very different than someone who is 30, but they might also be very different than the other 80-year-old who's sitting next to them. Just because a person is older does not automatically mean that certain things are true. Older adults are individuals, just like 30-year-olds are individuals. Ageism is discrimination. It's prejudice, and it reinforces negative stereotypes about getting older. Take a few minutes to think about examples of ageism. It's probably not very hard to find them just looking through a magazine or watching TV. And when you see those stereotypes, think twice about what it really means to get older. Let me know your thoughts. Have you been a victim of ageism on either end of the spectrum? Or maybe you're in between and someone's been ageist to you. Let me know, and let's have a discussion about aging. Thanks for watching. And if you want to know more about aging, go to www.thewrinkle.ca.